We see, unfortunately, patients every day whose blood pressure is not well controlled. And then they have one medicine, and then we add the second one, and the third one, and the fourth one, and we keep adding medications. And honestly, when the patient is on 3 or 4 blood pressure medications, including a diuretic, and there are either on the maximum dose or the maximum tolerated dose, and despite that, the blood pressure is really high, then we have to think that this might should be driven by something else. The correct thing to do for this is not to just keep adding medications. We need to find if there is, what's the root cause of the problem. Is there a hormonal problem that's driving this, what we call it, resistant hypertension? So resistant hypertension, also not just for resistant, by the way, when hypertension is diagnosed, as you mentioned, in a very young age, as someone who doesn't have a good reason to have a very high blood pressure, or like children. So there are cases like this where we really have to have a red flag that says it is possible that this is driven by hormones, and then this is when we need to look into it. The hormones, the adrenal glands, there are other reasons outside of the adrenal glands that can cause resistant hypertension, like, for example, problems with the kidney, the renal arteries, the kidney arteries, that you can tell us more about, which is the renal artery stenosis, or other conditions such as fibromuscular dysplasia. So basically, conditions that cause the blood supply that's going to the kidney to be affected. And then in this case, also the body can deal with, as a response, very high blood pressure happens. Now, the conditions that are related to the adrenal gland that can cause resistant hypertension, the most important is the primary hyperaldosteronism, or the excess aldosterone. When we mentioned that the adrenal gland is responsible for multiple hormones, one of them is cortisol, one of them is the aldosterone, there are the adrenalines, and there are the sex hormones. Really, every one of these hormones, when it is in excess, it can cause a problem. The aldosterone specifically, it is extremely common, and the amount of patients that we see are just really the tip of the iceberg. So there are a lot more patients that were not diagnosed, just having one medicine added after the other. And to remind you, what does the aldosterone do? The aldosterone regulates the body fluid balance, as well as the sodium and potassium in the body, and the blood pressure. So if there is excess aldosterone produced from the adrenal glands, then this can cause that resistant hypertension. And the problem doesn't really